Hello, class. My presentation is on Chapter 19, Improving Sexual Function and Pleasure in Transgender Persons. The introduction is for epidemiology, it is estimated that there are 25 million transgender people worldwide. In the US, the total US population prevalence is at 0.6%. There are many definitions for on this topic, and I picked three that we should know. Transgender is the umbrella term for people whose gender identity differs from their birth assigned sex. Gender identity refers to a deeply felt sense of gender that may or may not be consistent with the sex one is assigned at birth. And then gender expression refers to how you portray your gender to others, just such as through physical appearance, clothing, career choices, etc. There are etological considerations and theories concerning transgender people. For biology, there are genes identified in gender identity. Transgender parents will have transgender children. And twin studies have shown the heritability of gender dysphoria in the 30 to 60% range. There's also the prenatal androgen exposure. So there's evidence of in utero exposure to testosterone affecting a person's gender identity. Now, there are some psychosocial factors. That one is lack of parental reinforcement or parental absence, or the elevated levels of psychopathology in parents and child anxiety increase the risk of gender dysphoria, or childhood maltreatment, emotional, physical, and sexual abuse and neglect can contribute to gender incongruence. Now, an important thing to note is that transgender advocates disagree with psychosocial factors. They believe that nothing can make a person transgender. It is not caused by trauma or external influences. They strongly believe that it happens in the womb and that you are born that way. Now, there are diagnostic considerations. The DSM-5-TR has gender dysphoria classified as a mental disorder in order for transgender people to qualify for medical treatment. There needs to be a diagnosis to receive health care. So that's why it's there. But it is important to note that the diagnostic criteria to meet gender dysphoria is distress and not gender incongruence. Therefore, you do not have a mental disorder if you are transgender. You have a mental disorder if you are experiencing distress. Gender dysphoria is not a sexual dysfunction or sexual disorder. And there are transgender people who do not experience gender dysphoria. The World Professional Association for Transgender Health states that anyone can identify as transgender as long as they believe it. So yeah, you don't need a diagnosis or anything like that. Now, I listed the DSM-5-TR criteria, and so it defines gender dysphoria in adolescents and adults as marked incongruence between one's experienced expressed gender and their assigned gender, lasting at least 6 months, as manifested by at least two of the following. And then I listed the 6, and you only need 2 to have a diagnosis. So, like for example, a strong desire for the primary and or secondary sex characteristics of the other gender, or a strong desire to be of the other gender. There are tools to diagnose gender dysphoria. So self-surveys can be given to clients to assess thoughts and symptoms of gender dysphoria. And the most common well-studied questionnaire is the Gender Identity Gender Dysphoria Questionnaire for adolescents and adults, the GIDYQAA. They have they're given the Generalized Anxiety Disorder Assessment, the Patient Health Questionnaire, and the Gender Identity Reflection and Rumination Scale. And many studies have shown that transgender individuals who feel accepted in their communities or home have lower incidences of comorbid anxiety, depression, and suicide than those who are raised in communities where they feel mistreated. So it's very important for them to have support. In order to help people with gender dysphoria, there is the gender transition. So gender transition is the process of adopting characteristics that match gender identity. So there is the social transition of changing appearance, clothing, hairstyle, changing your name, and choosing your pronouns. There is the legal transition of arranging new identity documents. And then there are the physical changes of medical interventions such as hormone therapy and gender affirming surgery. Now, the treatments for gender dysphoria, the World Professional Association for Transgender Health has set recommended standards of care for treatment with flexible clinical guidelines depending on the client's needs. There's a website that you can go visit, and they will have their recommendations listed. So the first treatment is a non-operative treatment, which is psychosocial therapy and counseling. Support clients as they begin to implement their gender identity to their loved ones and society, answering questions and discussing body image regarding the society-based normative. The WPATH recognizes that psychotherapy can successfully help individuals with their gender identity without hormone-based medical therapy and gender affirmation surgery. I think that's wonderful because there are many people in the world who cannot afford hormone therapy or surgery. So it's good to see that psychosocial therapy and counseling is just as effective. And then there is hormone replacement therapy. And there's operative treatments of gender affirming surgery. Now, the sexual dissatisfaction experienced by transgender people are the following. One is due to body dysphoria, a core element of gender dysphoria, difficulty being nude with the partner, distress from being touched or touching oneself, or transgender individuals focusing on the sexual needs of their partner rather than their own, and genital dissatisfaction. Transgender individuals with unmet gender affirming treatment report difficulty experiencing genital stimulation during partnered sexual activity. And it's also reported that only 12% of transgender women and 15% of transgender men report deriving pleasure from genital stimulation during partnered sex. So sexual activity is high amongst transgender individuals, but dissatisfaction is very high, with 40% reporting unhappiness. Now, I listed some things on increasing sexual pleasure for transgender persons. The first recommendation is having an affirming partner with whom they can feel safe and respects their boundaries is essential. Sex therapy interventions are effective for transgender individuals and couples, such as sensate-focused therapy. Psychoeducation, body acceptance, and peer support is also critical. They can get self-help materials from LGBTQ organizations on strategies for coping with body and genital dissatisfaction. They can rename their body parts according to what they feel comfortable. So a vagina could be called an innie, a front hole, or a T penis, or a penis can be called an outie, junk, or bits. And then this was in the textbook, conceptualizing parts as acceptable based on their function. So they stated, it works. Why can't I use it? I enjoy it. And also to continue how to increase sexual pleasure, using fantasy and being clothed or partially clothed can improve comfort and pleasure in solo and partner sex. Using sex toys as adaptive devices for transgender and non-binary people. Also, viewing sexually explicit materials of transgender people to help visualize themselves as a sexual person. And also having sex in a way that aligns with their gender and sexuality, and also having a sexual identity that they can connect with. And this identity can change. So, for example, a trans woman who identifies as lesbian, but pre-transition, she identified as a gay man. And I want to end my presentation with affirmations for pleasure that is written by Ray McDaniel, who is a non-binary therapist working with a lot of transgender people. And I thought this affirmation was wonderful because sex has a lot to do with your brain as well. So she stated, "You are enough. You are not too much. There is nothing wrong with your body, even if you want to change it. You deserve to feel pleasure in your body, even if you want to change it. You are desirable and desire able. You don't have anything to prove. You deserve to have a partner who sees and respects you for who you are. You're magic. Don't accept partners who treat you as anything less. When in doubt, repeat to yourself, I deserve pleasure equity." Thank you for watching my presentation, and I hope you guys all have a wonderful week.